Hello viewers, today we have Dr. Yuvraj Monga from Dr. Monga Ayurvedic Medical Clinic, and we are going to talk about pre-diabetes and diabetes in a detailed manner. So my first question to you, doctor, is what is exactly pre-diabetes?
uh, Very recently this term pre-diabetes is becoming very popular in terms of awareness. So it has both good things and the bad things, that people are getting aware of it, so they're conscious, so we can prevent patients from becoming full-blown diabetic. So pre-diabetes is a stage where if we don't control the situation, the person, the man and woman, boy or girl, will become diabetic. And diabetes has its own consequences, as I've discussed in my earlier sessions. So, pre-diabetes is a stage earlier than diabetes.
So how is it different from regular diabetes?
It depends on the blood sugar levels of your glucose, blood glucose levels. So, if it has three ways of measuring it. One is normal blood glucose levels, which we measure. So if we have a fasting sugar of less than 100, person is non-diabetic. If the blood sugar is more than 125 of fasting of 10 to 12 hours, it is diabetic. But the people with blood sugar levels in the range of 100 to 125 are the ones who fall in pre-diabetic range. Also, it can be checked by oral glucose tolerance test or after food test. After the food, the blood sugar level should be less than 140. But if your levels after oral glucose test of 82.5 gram of glucose, and we measure the blood glucose after 2 hours, it is between 140 to 199. The person is pre-diabetic. Is more than 200 milligram per deciliter, it is diabetic. So there is a subset of population which is called as pre-diabetic. Another way of measuring is identifying the patient is HbA1c levels, glycosylated HbA1c hemoglobin, which is again less than 5.7. A person is normal, he doesn't have diabetes. More than 6.4, a person is diabetic. 5.7 to 6.4 is a population which is pre-diabetic, which uncontrolled, the patient with 37 to 50% or 60% will become diabetic. Yes, yes.
Are there any other systems where we can diagnose pre-diabetic patients?
No, this is these tests are sufficient.
Okay. And what is the prevalence of pre-diabetes in India as such?
Prevalence is, the numbers are alarming, not only in India, in globally. Like in US, in 2012, there were 80 million, 8 crore pre-diabetic थे. In India, recently the data has come in 2017, June, which I mentioned earlier also, that we know that 7% or around 8 to 9% people are diabetic. But ICMR study of 2017 of 15 state showed that 10.3 persons are pre-diabetic according to the fasting glucose levels and oral glucose tolerance test. And these population will become diabetic in near future. So it is a very big figure in 120 crore or 130 crore population. These numbers are alarming, and the patients should be made aware. Government should interfere at the school level, college level, at the general public level. The awareness of diabetes, pre-diabetes, risk factors should be done, and how to prevent it, it should be circulated. Thank you so much.
Thank you so much.